Okay, good afternoon, everyone. I'm calling the Southborough Board of Health meeting to order at 2:04 p.m. on Tuesday, June 11th, 2024. All board members are present. And first order of business is executive session. So I move that the board will be entering into executive session per MGL Chapter 30A, Section 21, and returning to open session to discuss contract for the septic inspector, as the chair has determined that an open meeting may have a detrimental effect on the town's position. Is there a second?
I second vote aye.
Okay, great. Safdar is aye. Liz?
Aye.
And Chelsea is aye. Okay, so the Southborough Board of Health is back in open session on June 11th, 2024 at 2:10 p.m. And we are going to move along in our agenda here. So public comment is next on the agenda. We do not have any public, so we're going to move on. Next is approval of minutes from 4/21, 5/1, 5/21. So I'm realizing that it's actually 4/23 and not 4/21.
Oh, was it? Oh, the notes were good though, but yeah. Oh, did they?
So, okay, so what we can do is we can post them in draft version. And then I just don't want to vote on the wrong date. So we'll post them on draft version on the website for the 4/23. It was 4/23, right?
I'll have to look at that.
Yeah, it was. It was Tuesday. 4/21 was a Sunday. Okay, so the minutes you have, I had gone through and edited some of them on the 4/23 and the 5/1. Were you guys good with those?
Yeah.
Changes?
Yep.
Okay.
Yeah.
And then I did not get a chance to read the May 21st Collins Center minutes. And I just want to make sure that I'm comfortable with those before we vote them. So I'm going to kick those, if you guys are okay with that, to the next meeting, because those I think are really important, especially because the other towns didn't have quorums.
Right.
Okay, so here's what I'm going to do. I'm going to move that we approve and post the open meeting minutes from 5/21, 5/1/24, and the morning session of 5/21/24 as edited today.
Second vote aye.
Zulik, aye.
Okay, Malinowski's aye. And then did you have any other changes to the 4/23 minutes? Okay, so I don't think we need a motion. I'll post the draft and then we'll revote with the right date. And then we'll kick the after the night session.
Chelsea, there's a version I have that says April 23rd.
I know, but the
new
agenda's
version.
wrong. The agenda's wrong.
Oh,
That's what I'm
okay. I was
concerned about.
gonna say, I thought it said the 23rd.
It did, yeah.
Okay.
And I
Right.
just looked at them again, and so I realized that the date's wrong. So sorry about that. Okay, so the next set is release of executive session minutes. So these are contract negotiation minutes. So are you comfortable with releasing those and posting them?
Yes. Vote
Yep.
aye. Second
Okay.
vote aye.
All right, so I'm going to move that we approve releasing executive session minutes from 1/22/24, 2/5/24, and 2/13/24. Is there a second?
Oh, second vote aye.
Zulik, aye.
Malinowski's aye. Okay, so we'll go ahead and do that. Thank you. Okay, so as we're all aware, Dr. Alker is no longer employed with the town. She's decided to move on, and that was effective last Monday. That was her last day. So it was Monday, June 3rd. So while we're working through a new health director position, I would like to recommend that we appoint Taylor West to be the interim health director, and we have the ability to do that per the SAP section 14, which also will give Taylor a 10% increase on her salary to do the extra work while she fills that role, the interim role. If Taylor, you're willing to do that.
Yep.
All right, any discussion on that before I make a motion?
Nope.
Okay, so I move that the Board of Health appoint Taylor West as the acting public health director per section 14 of the SAP, which will include a 10% increase of her earnings effective, and I'm going to backdate it to June 4th.
I second and vote aye.
I, oh, so I'm like, I, Zulik, I.
Yeah.
I'm like, I third? No, that's not right. That's not
And Malinowski's aye. Okay,
Mhm.
thank you. And I'll make sure that that gets communicated to accounting or payroll. Thank you. All right, next. Okay, so authorize Taylor West to sign off on payables and payroll. So this, as remember, probably about a year ago, we switched to have me do this.
Mhm.
And I think we've gotten into like a good cadence of knowing what the hours and the salary was. And I think part of the reason for that was because we had fluctuation in our leadership of the amount of hours, and there was some discretion used there. So I now that we're more on a set hour of Taylor taking over the interim role, I'd like to have Taylor be the primary sign off for payroll. And I would like, I don't know that we can do this, but I'd like Melissa Danza to be our second if Taylor's not available. So that way it's actually an employee of the town and we're not chasing board members to sign off on payroll. If that's not an option, then I think we can go back to Liz and I being the backup to Taylor. Thoughts on that?
Sounds like a good plan to me.
Sounds like a good plan to me too.
Okay, Taylor, any comment on
That's
that?
fine.
Okay, so I'm gonna move that the Board of Health authorize Taylor West to sign off on payroll and payables. And if possible, make Melissa Danza be our backup in the case that Taylor's not available. And if that's not possible, then have myself and Liz Zulik
Mhm.
do it. Second? There a second?
I second vote aye.
Zulik, I.
Malinowski's aye. Thank you. Okay. Next is ratify contract for sanitary inspector. So we just came out of executive session, and now we have to ratify the sanitary inspector in public. So I'm going to move that we approve the FY25 yearly contract for the sanitary inspector, contingent upon legal Labor Council review.
And second vote aye.
Zulik, I.
Okay, Malinowski, aye. All right, thank you. And thank you to Dennis for all the work he does for the town. I think we benefit greatly from his expertise. All right, next is public health nurse updates. So I'm going to hand it over to Taylor.
So do you want to do number 9 first, or do you want to do 10 first?
Oh, you know what? I have an old agenda. What's 9? Sorry.
Health director and health agent salary scale and job posting.
Thank you. Okay. Thank you. I forgot I added that. So, Liz Saptar and I were at personnel yesterday.
How'd it go?
Good. So,
Yeah.
they graded both positions. So I'm going to talk about them individually first. So they graded, the health director as a grade 8.
Mhm.
And within grade 8, there's 15 steps that, that you can bring somebody in at. Up to midpoint, which is grade 8, you don't have to go back to personnel board. So we need to post after this meeting, my intention is to post the job through the town administrator's office onto the town website for 10 days. And then what I suggest that we do is, and I'm open to feedback on this, I sent you some comps of health director and health agent, so this is related to both, that we post the range of step 1 to step 15 for grade 8. And then we identify one of us to work with us with a few, like, small number of stakeholders on reviewing applications and resumes, and actually then providing a recommendation after an interview process to the board. But I think we do the range because I think we need to make sure that we're comfortable with whoever we're ready, we want to make an offer to. I think we need to weigh all of that with compensation. So I would rather post it as a range and then have conversation as we're ready to make an offer.
I think that's okay. My only couple of questions are, so when we do this, this is sort of before our goal of shared services, right? So this is not anything, like, this is going to be for us, right?
Yeah, this is only us.
Yeah, because obviously when we look what we're thinking about long term, about especially for an agent, not necessarily for a director. The other question is how are we, I think, are we going to say MPH or I mean, we decided we don't necessarily need an MD, right, for the role, but in terms of like, what are we?
So we did RN as part of this.
I think that's good.
And hold on, let me just pull it up because I don't want to misspeak. So for the qualifications, do you guys want me to share my screen so you can see it? It'd be better.
Just can review it again.
Here we go. Can you see it?
Yeah.
Okay, so under education, training, and expertise, we said must be an RN under Mass Board of Registration in nursing with at least 5 years as an RN. And master's degree in public health preferred or related experience in public health administration.
Perfect. Yeah, as long as that's what we didn't want to go up. And I remember that, but I just wanted to make sure we had it.
Yeah.
Okay.
So, I think where we're an elected board, it does make sense to have one of us run a process. So I don't know what your thoughts are on that. This would not be like a public interview setting. It would be like the recommendation would come to the public setting with the board.
Yeah, I mean, I'm happy to take that on.
Okay.
I'm happy to take that on. So
okay, great. All right. So that's health director. And from a timeline perspective, post for 10 days and then, do the interview process. This is in the SAP for 7-1. So personnel board was able to, move it quickly for us. So I'm very appreciative that they did that. The only reason why we would have to go back to personnel board is if we're going over midpoint.
Right.
So that would be grade or step 9 or above in grade 8. Okay. So I will work with town administration to get that posted. Health agent, I'm not done with the IMA yet, so we need to do that. That came in at a grade 5.
Okay.
Is that expected?
No. Well, not based on the ranges and the comps that I have.
Okay.
So my concern is that even at a step 15, I'm worried. So one of the things that we put in the job description was preferred RS. And I think if it was RS, that makes a difference.
Mhm.
So so I think we should still go through, Taylor, you're
Can I
gonna.
ask a question?
Go ahead.
So I know we said preferred RS, but then also didn't we put in
Yeah.
it that they're required to get it within 1 year?
Mhm.
That's what I thought we did,
I
right?
Good.
I don't understand why that would make a
I think it does.
difference.
I mean, I don't understand like the inner workings of how they grade positions.
Right,
But I think when it's preferred, even if it's gonna be required, I think that makes a difference. So what I think we do, well, I think we have a couple options. We could post TBD on the job description for salary.
Mhm.
Or we could put the entire range of grade 5. I think those are our two options. I guess, does anybody have an opinion?
TBD sounds okay to me, in case we have some maneuver room after. I don't know. I mean,
If
that's
we
my.
think we actually have maneuver room, then let's post TBD. If we think we're really gonna be stuck within this range, let's post the range.
So I think it depends on what we get,
Mhm.
if we can then modify the job description.
Mm.
I think that will depend on if we have any wiggle.
Okay.
Okay. So different conversation
Mhm.
than the health director.
so I think Northborough really needs someone who does review of plans, approval of plans,
mhm.
which you technically need your RS for.
So you're just suggesting we just change it now?
I'm concerned that we won't hire someone into the position because it's not a credential that a lot of people have.
Mm.
I also am concerned that people who already have their RS would not apply.
If it says that you have to get it within a year?
No, if it's the range that we're quoting.
Yeah, so I do think going with TBD is
Yeah.
what we should do.
If they have their RS, I just want to be clear.
Mhm.
And I wasn't able to attend the personnel board meeting, so I'm not sure how the conversation went.
Mhm.
Are they willing to entertain regrading the position?
Mhm.
I think that would be my intention of asking them to do that.
Can we find that out before we post it?
So I asked the question yesterday, what I
Okay,
like to do.
that's what I'm asking.
So that's what I can do. Now, I would hope that they would entertain it if we ask, because obviously we're asking because we,
Are concerned.
yeah.
You know.
Okay.
But I'm not the personnel board, so I can't.
Yeah,
I can't,
no,
like,
yeah.
say, like they didn't take a position on it. I
Right.
just asked in general, like my concern. I explained exactly what I just
Yeah.
explained to you. Like I told them, I'm worried
Yeah.
about this and that, yeah.
Would another option be? We would post it, never mind. I was gonna say, can we see what Northborough grades it at, but they're not gonna grade it, right?
No.
Okay,
Where's
But I
their?
think we have enough comp data.
yeah,
But the thing is with the comp data, I can't tell. I mean, I guess I could go through and try to figure out who is an RS and who isn't,
Mhm.
but it's hard.
if you send me the comp data, I'm happy to look into it.
Okay.
Cause those are, initials that people put behind their name consistently.
All right. That would be helpful, Taylor. Just so that we have,
There's also a database online just to look it up.
okay.
So is
Great.
Northborough's at a level 5? Is that for it.
No,
Our-
so it's gonna be our employee that they
Oh,
reimburse.
well, okay, that's what I was kind of.
Yeah,
I didn't think Northborough
I
had its own
couldn't-
separate person. I didn't think Northborough had its own separate person. That's
No.
what we had talked about. Okay,
I
all
was
right.
like,
Now okay,
Yeah.
okay. So,
Okay. All right, so I have my marching orders on that. I need to get the IMA done for health agent too,
mhm.
so. I gotta figure out which comes first, the chicken or the egg, but. I'll continue to think about working on it. Thanks, Taylor. Sorry.
Sorry.
No, I had the wrong agenda. Go ahead.
Okay. First camp updates. The last meeting I told you I had concerns and people were due, so everyone got their applications in on time to me. I kind of just did a brief overview of the ones I was concerned about and they look good. I have also started meeting with camps and giving out licenses to camps that have already started with their training, so it will be a busy next few months getting out camp license and doing inspections, but so far everything's good. We'll probably have more camp updates in the fall and discussions about having if we want to set a due date for applications or if we want to continue with the 90 days before the start date of camp, but just so that it's on everyone's periphery, but we don't have to talk about that today. Tobacco Coalition discussion and updates. So Pari, who is our tobacco inspector, through the coalition, reached out to me to introduce himself. He came with Bill Murphy, who's the holder of the tobacco grant for all of the towns to be part of, and kind of went over our town and said that everyone was in compliance on their last check. We also talked about Zyn pouches, which are nicotine-based pouches. There's no tobacco in them. And then also Delta 8 products. Delta 8 products, as far as Pari can tell, have not been sold in convenience stores in Southborough, so that's good. And then they have a coalition meeting next Friday, which I unfortunately cannot attend, but they're going to take notes and they're talking about the nicotine pouches and that, so I can report back to kind of what their updates are there as well when I get more information.
okay, thank you, Taylor.
Yep. Sorry, I just lost the agenda. FDA food grant reporting, just so everyone is aware, our report is due at the beginning of July. That's the only update that I have there. So I will be reviewing that and hopefully won't have any questions for any of you about how to send in that report, but I'm sure it will be fine. I just have to figure it out. And then
I
the
think this
last one,
is mine.
yeah.
Okay, this should have been under me, sorry. Unless you want to talk about it.
No, I'm
Okay.
good.
So under the Greater Boroughs voting members, so on this one, we decided a few months ago to have me be the primary and Safdar, you be the secondary. So
Yeah.
we're running into a problem where you and I both can't be at the same meeting. Because then we have a quorum.
Right.
So can I suggest that Taylor and I be the primary and secondary, and that if I can't come,
Okay.
you can still sit in the meeting.
Mhm.
Taylor would just have the vote.
Okay, that's fine.
Is that okay? Okay.
That's okay
Because
with me.
I would rather be able to have you be there.
Mhm.
But I also need to make sure we definitely have a voting member there and Taylor doesn't
Yeah.
miss any meetings. So,
Right. Okay.
and Taylor is like very close to like what's going on with Burroughs.
Right.
Okay.
Oh, of course, no
All right.
worries. Okay.
So I'm gonna, if you're good with that?
Yeah.
Okay.
Yeah.
So I'll just let you know if I can't come. And
Okay.
Liz, same thing. If Safdar and I both can't come, you can still sit in
Right.
on that if your schedule.
I'm just dying to sit in on it. Yeah, I'll let you know.
On our 2-hour meetings.
But you know what? They are recorded. So
Oh, good. I can just listen to them at night. So we'll
Yeah,
never
you
miss
can
a
catch
thing.
up on it and all your spare
Good,
time after your
good.
kids go to bed, Liz.
there's
Taylor's always looking out for me.
so we had one this morning and it was a good conversation. So
Yeah.
Riveting.
yes.
Very.
All right. So I'm gonna move that I be the primary representative from Southborough on the Greater Boroughs and that Taylor be the secondary.
Second vote aye.
Zuluk, aye.
All right. And Malinowski's aye. Thank you. All right. Ugh, this one. So we talked about just a digitization project. It hasn't gone well.
No,
Nope. We needed to,
basically the long story short is that it's not happening, most likely.
Why?
So we met with OpenGov, who is who we would utilize for this project. We already use them in town for building and Concom. For permits and things like that. We spoke to the rep prior to the meeting about what our expectations were for the work. And then we had probably about an hour meeting explaining what we were looking for as far as uploading records that we already have scanned to be able to share with the public about the history of their septic systems, essentially. So every house, you would be able to look up the plans that we have in the Board of Health. We also talked about adding on to digitize or put online all of our applications so that people could send them in online as an additional, excuse me, as an additional cost, if it didn't cost as much. So they came back to us with a scope that did not include the digitization at all, only the applications, and they wanted to meet again to clarify what we were needing. Unfortunately, with our very tight deadline of needing the work completed by July 1, and we still have not got a response back about meeting to alter the scope of the project. Among also their deadline saying August, not July 1. Greater Boroughs grant will most likely, when we go to apply for it, will deny the request. So that, yeah, it's just,
so it's,
basically we've run out of time because of multiple.
and we don't even know, like, we don't have a clear scope. So
Right.
Boroughs hasn't even like, it's this whole process to get it approved through the state. So I think what we need to do is, I think we need to continue to work with them on getting the right scope so that if we do have funds become available throughout the year, then we're like ready to go.
Yeah.
The other thing that we're looking into just on the backside of this is that we can potentially figure out how to do this ourselves with maybe just some training from OpenGov, which we may have in our individual town budget too, or Board of Health budget to do. We just have to see what it is. If we're able to figure it out and upload all of these things ourselves, it would be free. But it's a heavy lift.
Yeah.
Right.
So that is a potential as well that I think Barbara and I are both open to. I don't want to speak for Barbara, but she does know it's a possibility.
And I mean, she's been scanning for years now,
Yeah, she would love it.
you know, so
Yeah.
I think I don't think you're putting words in her mouth. I think she
Yeah.
is on board with this. So,
Yeah.
So we're frustrated.
Yeah.
All right. We can move on from that. Meeting schedule. So I know we picked our next couple of meetings, so I just want to make sure we all have them. So July. What did we do for July? July 9th at 10. And August
We did the 13th.
13th at 10:30. Okay.
Do those still work for people?
Yep.
Okay. Also, I know that they're still kicking around fall town meeting date.
Yeah.
So obviously we have a stake in that related to the SAP for these positions. So that will be we'll have to probably our August or July meeting. Well, I mean, we won't have to put an article in for it, because it'll be included in the personnel board article, but we just need to be prepared to speak to it. So we'll have that on our August. Okay. All right. Anything else before public comment? Okay. We have no public comment or no public to comment. So I'm going to move that we adjourn at 2:39 p.m.
Second vote aye.
Would you look, aye?
And Malinowski's aye. Thank you. Have a good day.
Thanks,
Bye.
guys.